Welcome to Deuk Spine Institute, February 25th, 2025. I'm Dr. Deuk Majan. Our patient presents with piriformis syndrome as well as disc problems. She travels to us from South Florida. We just finished her Deuk laser disc repair, 2 discs, 4551, and facet treatment, Deuk plasma rhizotomy. Now, the piriformis muscle, Jordan, show us on the x-ray where the piriformis muscle is. You can actually see it, the outline of it right there. It's kind of gray. And it attaches to the top of the hip called the greater trochanter, specifically to the posterior facet and posterior superior facet. And our goal here is to release that muscle because it's torn and that tear is causing horrible pain intermittently in her top of her buttock, lower back. Okay? How do I know? I did an examination of her in clinic and I palpated her piriformis muscle at the top of her buttock where it typically gets torn, and sure enough she had the tear and pain, so with a muscle spasm. So I'm here to now fix that for her by releasing that muscle off the top of the hip. Henry, let's show the audience how that works.
Of course.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. You can see from the video, when you have a tear in your piriformis, the safest, best way to fix it is the Deuk piriformis release. This is a treatment that I developed, and it works. We've tried everything else, conservative, physical therapy, shots, pain pills. Nothing else works. And other surgeons will do a piriformis release, but it's highly invasive and bloody and painful, and it doesn't work more than half the time. But with this release, there's really no bleeding, there's minimal pain, and patients recover overnight, and the pain is gone about 95% on average. Now, about 1 in 20 patients, we don't get a full cut of the muscle tendon over on the hip, and the patients come back and they still have some piriformis pain, so we have to go back and redo it. But that does happen, it's just not common. But it does happen. So anyway, if there's no questions, we'll end and we'll be back for our last case in about an hour.
We have just one question, or technically 2 questions from Karsten once more on YouTube.
Sure.
Asking, will BPC 157 or HGH do anything for the healing of discs or facet joint and also in the piriformis muscle?
Yeah, great question. I don't know if those molecules will do that. We haven't tried injecting them, so I can't say that they work and I can't say they don't work. Good question.
Other than that, no current questions.
Was there another question?
No current questions. That was it. That was the piriformis muscle.
Awesome.
Was, yeah.
Well, thanks for joining us for this piriformis release, and the patient will be going home in about 30 minutes. Thank you.